Call us on 03030 80 55 55. Text 81771 or email the programme talk.back@bbc.co.uk.
Welcome back, everyone. Just gone, 6.5 minutes past 1. We talk a lot these days, don't we, about long COVID, the long-term effects of coronavirus that some people are still struggling with and will struggle with for months, possibly years in some cases. Extreme tiredness, shortness of breath, exhaustion after even basic physical activity. Problems with memory and concentration, that's sometimes called brain fog. Insomnia, really struggling just to sleep at night, or joint pain, muscle pains, that kind of thing. Some of you have talked to me on air about your experience of long COVID, and it has been devastating in so many lives. Those symptoms, though, they do sound familiar, don't they, to the thousands of people in Northern Ireland who have been living with the chronic fatigue condition called ME. And for many years, people here have been, with ME, have been telling us that that condition has not always been taken seriously enough by the health service or by some doctors. New guidelines have now been published. They come into effect today for ME. And the guidelines state that it's a complex and chronic medical condition, and they outline steps for better diagnosis and better management. So our question for you, maybe you have ME, please pick up the phone and share some of your thoughts on this, your experience of ME. Maybe you've seen, as I have, what ME can look like in the lives of friends or in family members. Please tell us if you think it's been taken seriously when you look at how it has affected the lives of those around you. You might have a child, you might have a family member living with ME and you see the effects of it. What kind of care is available? Or do you think they have been forgotten over these past years? 03030 80 55 55. Dr. Charles Shepher is with us, medical advisor to the ME Association. Charles, welcome. Good afternoon to you.
Good afternoon, William. First of all, can I just say, I think you've summed up the current situation both nationally and in Northern Ireland extremely well. And I've been over to Northern Ireland many times in the past 20 years, and particularly being involved with Joan, who's on the programme, and all the stuff that she's done to try and raise awareness of this condition and get a service, a specialist referral service in Northern Ireland that's fit for purpose. And I have to say, to start this programme off, I think it's a national scandal in Northern Ireland that you do not have a specialist multidisciplinary referral service where people can be referred from GPs for more help where necessary with diagnosis and management of this awful condition.
And the Joan you mentioned, Charles, is Joan McParland, Joan McParland, who is chair of Hope for Me, Hope for ME, that is, Hope for Me, and Fibro, Northern Ireland. Welcome, Joan. Good afternoon to you.
Hello, William. Thank you very, very much. I have personally been waiting on this opportunity for 22 years and 9 months to speak about ME and the situation in Northern Ireland.
That is the point 22 years ago when you contracted a virus.
Yes. Now, before we start, I have to say that I have seen the NHS at its very best. When my husband and son were involved in a car accident in 2007 with a, inverted brackets, real illness. And the GP care I see my elderly mother receive to this day is exemplary. But since getting an acute viral infection in October 1999, leading to ME, it has been a very different, demoralising and shocking experience of healthcare. No doctor intentionally goes out to do harm, but if not armed with the correct training, unfortunately, that is what is happening to ME patients to this day. But thankfully, the nice guidelines and science has moved on.
Joan, how many people do we think have ME in Northern Ireland today?
From I have started the campaign in 2011, the figures were 7,500, and that has remained so to this day because nobody counts them. Half the people aren't diagnosed. You can't get a diagnosis. Yeah. You're running from pillar to post trying to get it. And what we have to do is bring over a medical consultant from London to see patients here. And we also bring over a paediatric consultant to see children in Northern Ireland. We have been doing that for 11 years now. to try and halt the damage that is done when they're told to exercise and push through this disease.
Charles, can you fill in the gaps for a lot of the information that we need to understand what ME is and its causes, or what we know about the causes? Does it always begin with a viral infection, for example? Are there different ways in which people find themselves living and suffering with ME?
Yeah, what we know from, this illness is called ME, Myalgic Encephalomyelitis. And if you just split it down, the M stands for myalgic, which refers to the muscle involvement and the muscle symptoms. Encephalo means brain, so there's a lot of brain symptoms. And itis means inflammation. And so people have infective type symptoms which follow on. We think around about 250,000 people in the UK have got this condition. We think about 4 per 1,000 is the numbers. So back of envelope, I think population of Northern Ireland is around about 2 million. So as Joan said, the best guess we can make is there's 8,000 people in Northern Ireland with this, around about that. And most important of all, we know that about 25% of those are going to be severely or very severely affected. So that means they're housebound, bedbound, and at the very extreme, they may even be tube-fed and almost paralysed. The history that most people give for this is that they're a fit young adult. Most people start this illness in their 20s, 30s, 40s, although it can affect any age group, and it affects a lot of children and adolescents as well. But they get this infection and they don't recover. And this is just like long COVID. They're going back to the doctors weeks for several months after they've had this infection. It can be any type of infection, continuing to feel really sort of unwell, flu-like, and they've got these four very characteristic symptoms, which again overlap with long COVID. You name them to start with, and they are very simply this very debilitating fatigue, which is activity induced. It's made worse by exercise. The brain fog, or we call it cognitive dysfunction in medical terms, which is problems with short-term memory, concentration, attention span. There's a part of the brain which controls your pulse rate and your blood pressure, and that goes wrong. And this is what we call in medical terms dysautonomia. So people feel faint when they stand up. They can't maintain a standing position. And then they have a sleep disturbance. Very early on, it's quite often what we call hypersomnia. They want to sleep for excessive periods of time. But as time goes on, that changes to a more sort of just erratic problems with sleep, unrefreshing sleep in particular. So they wake up, even if they've had a good night's sleep, and they just do not feel refreshed. And on top of that, they have this very characteristic diagnostic symptom called post-exertional malaise, whereby any type of exercise or exertion beyond what the person can cope with just worsens all the symptoms. And I was a member of the committee that produced the new NICE guide. This is a very major step forward in both the diagnosis and management of this illness. And one of the key things which goes back to this lack of service provision in Northern Ireland is that we made a very specific recommendation in this guideline that people need to be diagnosed early and accurately within 3 months, or at 3 months from the onset of these infection-induced symptoms. And at 3 months, they then should be referred to a specialist referral service, hospital-based service, where the diagnosis can be confirmed, because there's a lot of conditions can get mixed up with ME and people can get a misdiagnosis, and expert help on management. And now that we've got a new NICE guideline, which has abandoned this awful treatment of graded exercise therapy, provides very sensible advice, guidance on activity and energy management, symptomatic management, what to do in relation to schooling, education, employment, and everything else that goes with it. We need to set up this service in Northern Ireland so that people get this help.
Well, Joan, that raises the question, doesn't it? Given that we see these symptoms, we see these conditions in people around us, and doctors have people coming to them with these conditions, why haven't we had such a service?
Oh, dear. I've 28 pages printed out across this table, William. Actually don't know where to start.
Well, let me ask a more direct question and just cut to the chase.
Yes, please.
Is it because there are some within the healthcare world, some doctors, who haven't taken this condition seriously over the years. Maybe they've even disputed whether it's a real thing over the years.
Yes, absolutely. You could spend years searching to get a diagnosis. You can go to... I was lucky. My GP was very honest. He said, I don't know anything about ME, but I will support you. And through 10 years, the first 10 years I lost of my life, he and I actually learned together. And now I have a lovely new GP, and the last thing she said to me about ME was, I would love some education. So the charity has actually, there's no education provided during medical training schools. So the charity has been in Queen's University. We educated 600 medical students over a period of 2 years, gave out information packs. We have developed a VR experience, which is going to be launched next week. We're sending out VR headsets to GP surgery.
Is that to give them a sense of what it must be like to live with this condition?
Yes, to give them a real-life experience in a VR headset, what ME is like and how it happens. So the whole thing hinges on medical education, which we are very, very focused on.
It's extraordinary, though, isn't it? Joan, isn't it extraordinary that we need to do that with some doctors?
I can't believe it. What other disease does the patient lying in the bed with an iPad, as I spend 80% of my life doing, because I can't be upright for very long, what other disease leaves a patient lying in a bed organising a conference, bringing over experts from America, Norway, you name it, we have had them in Northern Ireland.
Yeah.
And
just to persuade them that this is a real thing that they need to take seriously.
Appearing at the conference as Norman William and collapsing in your bed for maybe 3 months after it.
Yeah.
There's not another disease that a patient has to educate the caregiver. So we're very focused on that. There was attempts here in Northern Ireland to set up a clinic twice. There
was a part-time clinic at one point, wasn't there?
Oh, that never happened. It never happened. There was 2 attempts by the Health and Social Care Board to set up, to recruit an ME consultant and to set up a clinic. Although part-time, we were told the service would grow.
Yeah.
Now, we enlisted the help of the Patient Client Council in 2013. It's 2022 and we are not one step further on.
So that is the importance of this conversation. We're talking to Dr. Charles Shepher and Joan McParland. I'll bring other guests in a second. But lots of you are getting in touch with your experiences of this condition and indeed of long COVID and the symptoms that are very similar. Some are hoping that, for example, the focus on long COVID conditions might actually have an overlapping benefit for ME, in that by taking that seriously, we'll finally get round to taking ME more seriously. Some of you are hoping that will happen. Kyla is there. Hi, Kyla.
Hi, William.
What's your situation, Kyla? Can I ask?
I started off in my early teens with pains and brain fog and things like that there, and I kept going to the doctor to no avail. And after 5 years of not knowing what was wrong with me, I paid privately to go to a neurosurgeon, and I was diagnosed with ME and fibromyalgia. And
you had to do that yourself.
I had to do that myself. I was at the point where I would have been happy to have been told I had cancer. That's how desperate I was for an answer.
How bad did it get for you, kind of?
To the point where I didn't know whether I wanted to live or to die.
Oh, God. And today, how are you feeling today?
Today is not a good day. I'm very, very sore. My memory's very bad, very poor. Aches and pains from head to toe. I could sleep all day and all night, but still I feel exhausted.
And so you've got some good days, you've got some bad days, you've got some good bits of a bad day, that kind of thing?
Yes, yeah.
What do people say to you around it? Do you feel a stigma about this condition?
I do, because people look at me and think, oh, she's overweight. If she'd lose weight, she'd be all right.
Mm-hmm.
But it doesn't work like that. I've lost weight. I've lost 5 stone.
Yeah.
And the pains are actually worse.
Kyla, thank you very much. I really appreciate it when people like Kyla just trust us and tell a bit of their story. It's important that we get the reality of people's lives on air. Jim in Belfast there texting to say, doctors need to be taught to take this seriously. My daughter struggled with ME for years, and their sneers before finally being diagnosed with MS. All those years lost due to indifference, says Jim. Edith is in Portadown, from Portadown. Edith was diagnosed with ME back in 1993. Was it, Edith? How old were you then? Welcome.
Hello, William. Thank you for having me on. Yes, I started off with not feeling well for a few months off and on. It was a strange thing. And then I got a sore throat, which I had been prone to, and a really bad sore throat. And I was home for 6 months from the civil service. And it had to be 6 months before you got the diagnosis then.
Right.
Now it's 3 months.
So that was a viral infection, was it?
And that was a very severe viral infection. And I still have days now when I can't get dressed. I'm too tired to do that. I'm having sleep problems, which Dr. Shepher was talking about. And the pain. And when I first got it, I fell down the stairs twice. I woke up 9 mornings paralysed and couldn't scream for my mother in her 70s. She was bringing me my breakfast in bed and things. And I crawled up the stairs and came down on my bottom. And sometimes if the back's still sore, I crawl up them.
Edith, thank you very much. It's awful, the descriptions that we're getting even texted in. Just awful how people have struggled to be taken seriously with the conditions that they have. Amanda's there too. Hello, Amanda.
Hello, William.
Hi, Amanda. What's your situation?
I was diagnosed in 2011 with ME. I had to go to a private consultant for nearly a year with symptoms before he would diagnose me with ME. When he did diagnose me with ME, he said, unfortunately, there's nothing can be done. But really, to be honest with you, not that anybody wants to have an illness, but because my symptoms were so severe, to have that diagnosis, at least I knew.
Yeah.
I people, I was thinking, people thinking I'm imagining this.
Yes. Yeah.
Which I wasn't. I mean, I was...
Is that the most common kind of sneering experience you've had? People say it's all in your head. You're just imagining this.
Yes, even going to GPs. I haven't been to GP for months because when I go, they just sit back and say, Amanda, what do you want me to do for you? And I'm saying, but you're the doctor.
Yeah.
I need help. And I give them my symptoms.
Can't you at least treat some of the symptoms?
Sorry?
Can't they at least treat some of the symptoms?
Well, they can treat the pain. The pain didn't come for me until a year later. My main symptoms at the start was I thought I was having dementia. I had memory loss. I was a carer in the community. I was forgetting how to get to houses where I was going to for years, trying to cover with people I was working with, making a joke out of it, which I was really, really struggling.
Yeah.
Memory loss was really bad. I go from severe fatigue to insomnia, and it's just changed my life so much, and it's frustrating as, that there was supposed to be a clinic put up and it didn't happen. And now, and it sounds bad, but I feel people with long COVID, it's horrendous for them, but I'm worried that there is something comes and ME patients will get pushed back.
Amanda, thank you very much. We've got some people texting and saying, what about this new service we have, the post-COVID syndrome service? It's been set up in Northern Ireland and in other places. Again, there is some hope amongst people with ME that some of the learnings there, some of the treatments, some of the therapies might actually have a transferable impact for them. Dr. Eddie Murphy's on the line from University College Dublin, a clinical psychologist. Eddie, welcome. Good afternoon to you.
Good afternoon, William, and to Joe and Dr. Charles. And I think it's important for me just to say that, and you can hear it, that individuals with ME have experienced incredible prejudice and disbelief and been stigmatised when it comes to through family, friends and healthcare professionals. and in the context of their illness. And I think it's important also to say that while cognitive behavioural therapy or psychological-based therapies, it has a role in the management of the symptoms and improving the functioning and the distress. But in and of itself, the whole area of fixed incremental increases in exercise is not appropriate. And I think it's really welcome, the new guidelines from the NICE guidelines that are talking about energy management. To me, it's a more compassionate way that the guidelines have been structured, which is very individualised, and it talks about the management and supporting individuals through their specialist teams.
So in the past, people were just given these graded exercise therapies where you'd say essentially, let's get you walking more a little bit every time incrementally, and you kind of walk your way to some kind of solution.
Well, it mightn't be that simple, but graded
exercise
was one of the features of it, really. And now it's more around energy management. And with any chronic condition, whether it's chronic fatigue or it's around energy management, generally speaking, what happens is when people feel really well, might have a good day, they overdo it, and then they pay for that. And I'm sure Joe will say that to you. And it's really about how do you do it within limits and actually do it at an individual. But you can, the psychological impact is significant for ME because it impacts on your life, your activity, your engagement in relationships, your social, educational, if it's children and adults. So it does impact.
Well, there's Julian there texting me, whoever Julian is, saying this is a yuppie disease. Well, I mean, Julian, thank you for voicing out that. But I'm grateful for Julian, for saying what a lot of people out there who have been pushing the stigma are actually thinking at times, because that is the myth, isn't it?
It's a physical illness. It's not a psychological illness. And I think, and I'd like to give Jo maybe more to space there, because I know if she's waited 20 years to talk, you should be going there now, Jo.
We've only got a minute and a half. I want to give Joan and Charles a final word, because the focus, Joan, is we've got a sense of it. We're making progress. We've got some nice guidelines. COVID may have actually helped in a sense in that there's some new focus on this. We need a referral service now, don't we?
Yes. Twice the Health and Social Care Board have attempted to set up a new ME clinic in Northern Ireland. Twice good candidates have applied. Twice this new clinic, an ME specialist, never materialised because HSCB couldn't deliver.
With this post-COVID syndrome service?
No, an ME clinician.
It needs to be specifically on that.
That's specifically what it was for. 2018, they got a gentleman.
No, I'm talking about where we are now. Charles, do you think the post-COVID syndrome services could have an overlapping usefulness here?
They've got an overlap because there is this terrific overlap between some of the symptoms of long COVID and the post-viral symptoms of ME. So it should be a two-way process. We've got an awful lot of help and information we can provide to the long COVID community from what we've learned about the management of these symptoms. But at the same time, there's all this research money, services going into long COVID, and I'm sure the ME community are going to benefit from that.
Guys, thank you all so much. It's been a learning experience for me and for all of us. We need to do it again. We need to talk more about this. So many have been in touch with us, but thanks to all of you. That's it